presenters have been compensated for their time.
Welcome to Rapid Recaps, your place to explore the challenges of chronic spontaneous urticaria, or CSU, and learn more about RHAPSIDO, or remibrutinib. In each episode, experts share knowledge to help healthcare professionals like you navigate CSU management with confidence. My name is Dr. Michael Blaze, and I'm a clinical professor in the Division of Allergy, Immunology, and Rheumatology at the Medical College of Georgia at Augusta University in Augusta, Georgia. And I'm joined by my colleagues, two leading experts from allergy and dermatology specializing in CSU, who will share their insights on this condition that presents across specialties and in different clinical settings. Would you introduce yourselves?
Hi, I'm Dr. Adam Friedman. I am professor and chair of dermatology, residency program director, director of translational research, and director of supportive oncodermatology at the George Washington School of Medicine and Health Sciences.
And I'm Dr. Priya Bansal. I'm an allergy, asthma, and immunology specialist at the Asthma and Allergy Wellness Center and clinical assistant professor at the Northwestern Feinberg School of Medicine in St. Charles, Illinois.
Welcome, and thank you for joining us. Before we dive in, it's important to note that RHAPSIDO is indicated for the treatment of chronic spontaneous urticaria in adult patients who remain symptomatic despite H1 antihistamine treatment, and is not indicated for other forms of urticaria. Important safety information and a link to the full prescribing information can be found nearby this video. In this video, we'll explore the REMIX trials, the largest global phase 3 program for an oral CSU treatment. RHAPSIDO received approval based on data from the nearly identical REMIX-1 and REMIX-2 clinical trials. Dr. Friedman, would you like to start us off?
Absolutely. REMIX-1 and REMIX-2 were randomized, double-blind, placebo-controlled studies. Patients were randomized in a 2-to-1 ratio to receive either RHAPSIDO 25 milligrams twice a day or placebo. Now, both arms received background H1 antihistamines throughout the study period, which I appreciate because that mirrors the real world. Eligible patients were 18 years old or older, had CSU for a duration of 6 months or more, so that's well over the 6 weeks line in the sand for CSU, prior to screening, and had a diagnosis of CSU that was inadequately controlled by second-generation H1 antihistamines. Here you can see the key exclusion criteria for the study. Patients were excluded if they had a clearly defined predominant or sole trigger of their chronic urticaria, so therefore not CSU, and use of dual antiplatelet therapy, among others.
And Dr. Bansal, what were the primary endpoints used to evaluate efficacy in these studies?
The co-primary endpoints were hive severity and itch severity over 7 days at week 12, measured as the least square means change from baseline. The key secondary endpoints were the UAS7, as many of us do in the clinic, or urticaria activity score over 7 days at week 12, proportion of patients with UAS7 less than or equal to 6, or well-controlled disease at weeks 2 and 12. Proportion of patients with UAS7 equal to 0 or complete absence of disease activity at week 12. Cumulative number, and this is important, of angioedema-free weeks. So this was looking at the angioedema activity score over 7 days, or AAS7 equal to 0 up to week 12. The REMIX studies were designed to have 24 weeks of double-blind treatment with RHAPSIDO or placebo. After week 24, patients taking placebo transitioned to RHAPSIDO for 28 weeks of open-label treatment with RHAPSIDO. The efficacy of RHAPSIDO was assessed using patient-reported outcomes, or as we know, PROs. So hives and itch are frequently assessed in clinical practice, and these are very common to what we see as key measures of disease activity in CSU. HSS7 measures the daily number of hives over 7 days. As you can see on the left, patients rate the severity of their hives twice daily. 0 would be no hives, and 3 would be severe hives. The greater the number of hives, the higher the severity of their hives. The sum of the average daily hive severity scores over 7 days gives us the total HSS7 score, and that can range from 0 to 21. And then on the right side, which is measuring itch, so that's the ISS7, that's that daily severity of itch over 7 days, similar to the HSS7, Patients are rating their itch severity twice a day on a scale from 0, which is no itch, to 3, which is severe itch. When summed over the 7 days, the total score can range from 0, no itch, to 21, indicating severe disease. In the REMIX trials, efficacy was also assessed with the UAS-7, a secondary endpoint. The UAS-7 is the sum of the daily scores for hives, or HSS-7, and the itch, or ISS-7, that the patient summarized for each day over 7 days. The UAS-7 scores range as follows. So a UAS-7 score of 0 indicates absence of hives and itch. 1 to 6 indicates well-controlled CSU, 7 to 15 mild, 16 to 27 moderate, and finally that UAS-7 score of 28 to 42 is indicating severe CSU. A higher score indicates that more severe itching and hives, owing to a greater disease burden and underscoring the importance of utilizing those PROs to uncover patients who have uncontrolled symptoms. When we're looking at REMIX-1 and 2, we enrolled a broad population of patients who remain symptomatic on antihistamines. So the baseline demographics were generally balanced across both the treatment arms and also between the two trials. As you can see by the UAS-7, HSS-7, ISS-7 scores, most of the patients were experiencing moderate to severe disease at baseline.
In summary, RHAPSIDO was evaluated in REMIX-1 and REMIX-2, which enrolled a broad population of patients who remained symptomatic on antihistamines. The co-primary endpoints of the HSS-7 and the ISS-7 measured the mean change from baseline in both hives and itch severity at week 12.
Indication: RHAPSIDO, remibrutinib, is indicated for the treatment of chronic spontaneous urticaria, CSU, in adult patients who remain symptomatic despite H1 antihistamine treatment. Limitations of use: RHAPSIDO is not indicated for other forms of urticaria. Important safety information: warnings and precautions. Risk of bleeding. Mucocutaneous-related bleeding occurred in 9% of patients who received RHAPSIDO. Interrupt treatment with RHAPSIDO if bleeding is observed, and resume if the benefit is expected to outweigh the risk. Interrupt treatment with RHAPSIDO for 3 to 7 days pre- and post-surgery or invasive procedures. Use of antithrombotic agents concomitantly with RHAPSIDO may further increase the risk of bleeding. Consider the benefits and risks of antithrombotic agents when used with RHAPSIDO. Monitor for signs and symptoms of bleeding. The use of live and live attenuated vaccines should be avoided in patients receiving RHAPSIDO. Adverse reactions. The most common adverse reactions, incidence greater than or equal to 3%, were nasopharyngitis, bleeding, headache, nausea, and abdominal pain. Drug interactions. Remibrutinib is a CYP3A4 substrate and a P-glycoprotein (PGP) inhibitor. Avoid use of RHAPSIDO with strong or moderate CYP3A4 inhibitors. Concomitant use with a strong or moderate CYP3A4 inhibitor increases remibrutinib exposure, which may increase the risk of RHAPSIDO adverse reactions. Avoid use of RHAPSIDO with strong or moderate CYP3A4 inducers. Concomitant use with a strong or moderate CYP3A4 inducer decreases remibrutinib exposure, which may decrease the efficacy of RHAPSIDO. Monitor more frequently for adverse reactions when using RHAPSIDO with PGP substrates where minimal concentration changes may lead to serious adverse reactions, for example, digoxin. Remibrutinib increases exposure of PGP substrates, which may increase the risk of adverse reactions related to PGP substrates. No data are available on concomitant use of RHAPSIDO with anticoagulants. The concomitant use of RHAPSIDO and anticoagulants was not allowed in clinical studies. Use of the antiplatelet agents acetylsalicylic acid at doses up to 100 milligrams daily or clopidogrel up to 75 milligrams daily was allowed in the RHAPSIDO clinical studies. Use in specific populations. There is a pregnancy exposure registry that monitors pregnancy outcomes in women exposed to RHAPSIDO during pregnancy. Avoid use of RHAPSIDO in patients with mild, moderate, or severe hepatic impairment, Child-Pugh Class A, B, and C. RHAPSIDO exposure is increased in these patients relative to patients with normal hepatic function.
This wraps up this video. Thank you for watching Rapid Recaps on RHAPSIDO. We invite you to explore the other videos in the series to learn more about RHAPSIDO and its role in CSU treatment. Explore clinical insights and treatment considerations for CSU at rhapsido-hcp.com.